The opportunity to present a conflict of interest. Are there any conflict of interest that need to be disclosed? Seeing none, we'll move to the next item, which is the mission statement. And Dr. Nettles, if you'd be kind enough to read that for us.
Yes. Mission: to improve the health and wellness of Nashville by providing equitable access to coordinated patient-centered care, supporting tomorrow's caregivers, and translating science into clinical practice.
Great. Thank you. Next item up is the minutes. If you've had an opportunity to review the Finance Committee meeting minutes from May 29th.
I've had an opportunity,
Okay.
so I move that they be accepted.
Okay, I'll second that. There's no further discussion. All in favor? Aye, motion carries. Next item on the agenda is contracts. We'll start out with, I'm sorry. Oh, I'm sorry, public comment. Okay, no public comment. Sorry about that. Went out of order. So no public comment for the record. Next item on the agenda is contracts, UKG Phase 1. Diana Walford.
Good afternoon. Before you have the UKG Workforce Pro timekeeping and HR system. They're two separate contracts, and we respectfully request that you approve these contracts. Our current UKG payroll platform is no longer supported, and it must be upgraded. So we have an opportunity to have one system for HR payroll processing from recruitment to termination. This is a cost benefit for the organization. Oh, thank you. This one system approach allows for all phases of the HR cycle, including talent acquisition, onboarding, scheduling, benefits, pay for performance, coaching, compensation, learning management, employee records, and offboarding of staff in one place. It allows leadership to have data and tools to manage the people resources within their areas. As you can see, there's a total cost for the payroll implementation, which is the first phase, and then the HR system implementation, which is the second phase. And this will allow us also to work with our current scheduling model for nursing, because we have a separate module for that. So this will also include it for additional cost savings. Also within this proposal are multiple discounts from the vendor to allow us to have some significant cost savings in going forward, and delayed billing as well.
So the only question that I have is that this seems to adequately suit your purpose for now and for the next few years?
Yes, ma'am.
And just for the record, there's no other entities that have been priced with this. Can you just quickly address the fact that there's not any other?
There is only two vendors that have the potential to have this full sweep. UKG is one, Workday is the other one, but we're not a large facility. We're a single standalone, so Workday was more expensive and has the ability. I actually priced this out back in 2023. And UKG actually came in lower, but I didn't do a new review because they gave us such a good discount in this. And again, there's only two vendors that in this market that have this full suite for an HR system.
Madam Chair, I have a general question about that, and I appreciate the new forms that tell us whether there was a RFP or not, but I'm confused about a number of them because no RFP would be checked, and then there would be three vendors listed with different prices, and I'd like to hear an explanation for that. And some of them I couldn't, like the RFP circle was blacked out, and the other one was no RFP was X'd out, and it was a little hard to tell which ones had it and which didn't.
Christy?
Dr. Martin and Chair, just to maybe address that, I think that's not specific to this contract, but I do know what you're talking about. I was reviewing the contracts here. I think when we get to those specific contracts, maybe the individuals who will be specifically addressing those contracts should probably address those needs at the time. So I see Christy Lewis up as well. Would you, any extra comments to add?
Yes, Madam Chair. That was a revision in response to a request to have a formal process. There are times where individuals are not going through an official RFP process. I have created a quick reference guide that gives an explanation on how to properly complete the contract information sheet. So in the future, if individuals are not going through a formal RFP process, we've asked them to provide in the comments section the quotes or the information that they are getting from vendors. If they are going through a formal RFP process, then we do ask them to indicate that they have, and then to complete the information for vendors 1, 2, and 3. So that clarification on the instructions is in a quick reference guide. Everyone receiving will receive that tomorrow.
Okay, any further discussion around the UKG Phase 1 contract? Okay, seeing none, I'll entertain a motion to approve that contract. I'll second. No further discussion, all in favor? Aye, motion passes. Second contract again, Diana, UKG Phase 2.
Okay, so phase 2 goes hand in hand with the HR, that's the HR side of the program. So we will have one suite that will have everything from payroll, timekeeping, scheduling, all the way through the HR system, onboarding to offboarding. One place where all employees will have access to mobile data, and the leaders will have access to resources in real time, because it's one system. Right now we have 3 to 4 separate systems that talk to one another, but they don't. We have to pull data from here to here to here to try to gather data in real time. So this will be a cost savings just in time management and getting true data through our leaders, because they can manage their employee information as well, because they will see it in real time.
So this is a just second iteration of a UKG system that's needed, correct? I think I'd talked with you and Dr. Blackledge before. This was previously a Kronos timekeeping system that we're now upgrading, or that UKG was a product of Kronos, I think.
That's correct.
Okay, and so we're just upgrading this from a prior system that was not as robust as this, and this will allow us, through efficiencies based on the product suite, to leverage time, also accuracy, and perform functions that are a lot higher level. I know we talked about, for instance, with PTO and things like that, that would be helpful.
Absolutely.
Right, and I was getting ready to add too, when we think about our labor efficiency and how the workforce is managed, this allows employees to engage in some self-management. It allows us to have analytics, which we do not have today. This allows us to ensure accuracy of some of the items that we're going to talk about a little bit later today. But it is phase 2. We have negotiated what we consider a substantial discount for phase 1 that actually sunsets in December. And then we'll work on phase 2. But it is critical to our organization to have the proper tools for the leadership teams, and then also for the employees to engage with the latest and greatest innovation from a digital standpoint, to be able to use their mobile phones. And then from there, the savings. So we have 4 separate systems today. And so this enables us to have some level of integration. And so when we think about how do you drive a workforce forward, and we think about like the checklist, today we send items via email. One email to the other person, it may miss 3 other people, and that person that received it may not open it. So when you get into that space, the gaps are then created. So Diana's goal and the entire team goal is to have a platform that enables us to have some efficiency. And then we think about the great places to work. I mean, great places to work have tools like this that drive engagement.
Thank you for that additional comments. Any other discussion points? Seeing none, I'll entertain a motion to approve UKG Phase 2. Second, no further comments. All in favor? Motion passes. Aye. Next is MCG.
MCG is a nationally recognized criteria for determining medical necessity, both for outpatient procedures and for hospital admissions. All insurance
insurance companies use one of two nationally recognized criteria, either MCG or interqual. It is necessary in determining medical necessity prior to asking for prior authorization for outpatient procedures, helping us then reduce denials. If we see things are missing, we can request additional data from doctors prior to sending it off to the insurance company. And then we also use it on the inpatient side to determine level of care. It also reduces denials on that aspect. If a company uses the other criteria, you still have your criteria to use in a peer-to-peer. We can provide that information to our doctors so that when they have that peer-to-peer with the insurance company, they have arguable points to request payment of that level of care. As I said, it's one of two criterias that are out there. In our contract with this, it gives us access to an integrated version that's in Cerner that actually allows us to do the review in Cerner and send that review to the insurance company directly. And then also it still gives us access to a freestanding website that doctors and providers throughout the hospital can use, and that they can kind of help learn some of that and get some of that before our team has to jump in and potentially make corrections. So the cost is for a 3-year term at $28,311 with an annual increase of 5%. As far as other bids, we have partnered with MCG since 2022. As I said, there is only one other recognized national company out there, but this particular product now is embedded in Cerner. With MCG alone, we spent 214 days on conversion activities, including education, implementation, and follow-up education activities and testing. And this does not even count the hours done on internal education with physicians and other areas. So to switch criteria at this point, after we just embedded it in Cerner less than a year ago, would be a significant investment in time, resources, and it would cross several departments and several vendors. Any questions?
Well, you certainly answered the question that in that latter part, because I was wondering about with Cerner and also what would be the learning curve and to get everybody on board in order to use this effectively and efficiently.
And as far as the division, I can't tell you the exact numbers. It's probably about a 50-50 with insurance companies. Blue Cross uses MCG. United Healthcare uses Interqual because they own it. Your prison contract right now uses Interqual, but they will recognize our MCG criteria and argument. So it's a kind of a 50-50. A larger institution, yes, by all means has access to both. Of note too, having MCG right now is kind of beneficial. Blue Cross will pull up the criteria for you, but in the future, Ambetter, and I believe some other companies are actually going to give you access to their Interqual criteria as part of your submission online. So you still want one because you want your doctors to have access to something, and you want to be able to run that criteria and send that off to the insurance companies. But at this point, we are invested in this one, and it would not be financially responsible to try to change at this point.
Well, certainly having experienced personally something like that, the quick or at least being able to identify where you can have access to things in order to get the information flowing is very important. So, yeah, thank you.
Okay, thank you for the information. No further discussion. I'll entertain a motion to approve the MCG contract.
So moved.
I'll second. If there's no further discussion, all in favor? Aye, motion passes. Next up is Comcast.
Good afternoon. So there's several data circuits. I'll go over them as you have them listed here. For Comcast, they are providing clinic internet and also a new service for a redundant internet at Nashville General. Oh, my name is Adam Bertram. I'm the IT director. Melanie Thomas is out of the office this week, so I'm presenting for Melanie. These are all renewals except for the aforementioned new service that will provide redundant internet for Nashville General as part of business continuity in case the current internet circuit goes offline. With more moving to the cloud, we need to ensure our connectivity and access to those services.
Any questions or discussion for Mr. Bertram?
So this is the first one that has three vendor
Yes.
pricings?
So we did not go through a formal RFP, but we did gather 3 quotes on all of these.
I see.
For the data circuits in particular, we used Comcast, AT&T, and Lumen. You'll see that farther down, there's an AT&T as well as a Lumen contract. That's for carrier diversity as well, but all 3 did bid out all services. We then picked the appropriate service and pricing for carrier diversity and the services they provide.
Thank you.
Anything else? Okay, I appreciate the different vendor options and the explanation. All right, no other discussion points. I will entertain a motion to approve the Comcast contract. Second, there's no further discussion. All in favor? Aye, motion passes. Next up, Liquidware Labs.
Liquidware Labs is a third-party software that provides analytics, monitoring, security, and tools to help manage our virtual desktop infrastructure. It gives us security. It allows us to use a single image rather than purchase 400 physical PCs. This tool helps us to manage that with fewer staff. We did get 3 bids. They were all for the same product as it's been in use for 10 years. And to forklift that product would be a large lift. Also, they do have 1- and 2-year options. The 3-year option is basically twice the 1-year option. So there's a year free service if we go for 3 years. That's why, even though it's a smaller dollar amount, this one is going to the board.
Can I ask a
Sure.
an ignorant question? What is virtual desktop infrastructure?
So we have physical PCs. We also have a server farm with 400 virtual PCs that run to reduce hardware costs, to reduce software costs. So rather than running out and purchasing 400 physical PCs and the management and update security that goes with that, it's much easier at the bottom to have a single PC that then gets cloned out so that when you log in, it appears as if you have your own PC, but in reality, it's virtual. It is not a physical, real PC.
Okay, thank you. Any other questions or discussion? Not, I'll entertain a motion to approve the Liquidware Labs contract.
So moved.
I'll second. No further discussion. All in favor?
Aye.
Aye, motion passes. Next up is Dell CSP.
Both of these next 2 contracts kind of go together. They are our Microsoft licensing. The CSP is our cloud services provider, and that is our Office 365, our M365, things like email, Excel, Word, file storage, SharePoint. That licensing from Microsoft comes in the form of a CSP. That's a 1-year license, and while it appears to be $10,000 cheaper, that's because we had to move some of those services down to the MSP, which is why the MSP may appear as a larger price, but overall there is a $38,000 reduction in when you combine both of those licensings. So for the CSP, this is strictly the cloud, SharePoint, email, Word, Excel, Office, things like that.
Okay, I don't have any questions.
Right.
I'm just going to assume that this serves your purpose.
Yes, it does.
I mean, it really does meet what you need to do.
Yeah, so in addition, we also did a software assessment given the changing environment in IT, the change in Nashville General. We want to make sure that we are HIPAA compliant, compliant with Microsoft itself. You know, we don't need auditing from Microsoft.
Right.
And to get all of our licensing in order and in the correct numbers. We did perform that. We then bid that out to Software One, Presidio, and Dell.
Okay.
And Dell came back with the lowest price.
And especially since moving with the cloud,
Yes.
making sure that, and again, this will be something that staff will readily be able to adapt and to fully use it correctly.
All of this has been in place for 9 or 10 years already. This is just another renewal. It is
But
moving
it should be an
vendors.
upgrade. At least it should be. We weren't using the cloud 9 years ago.
Correct,
Yeah, okay.
It's moving providers just based on price, but it's a renewal of the services that we currently have.
Okay.
Because this is the licensure of the product, correct?
Of using in the cloud, yes, for
Using,
SharePoint,
okay.
email,
All right.
Office products.
It's just a license.
Licensure, okay, all right, that's
that
what I
right?
was missing. Okay, I'm sorry.
And access to those services online.
And not to jump ahead, but the second contract also is a Dell contract. And the question I have with that is, are we able to at all leverage that type of cost structure since we're using services, separate service models, for lack of a better term, from the same entity, or no?
What do you mean by call structure?
Like if we're spending basically 382,000 and then another 328,000 over these terms with Dell, and we're choosing them versus one contract being with Dell, one contract being with Presidio, are they giving us a discount?
In either case, Dell was the lowest price on both contracts, because we can mix that up if we need to. If the MPSA had to come from a different vendor due to that pricing, we could go that way. But Dell on that MPSA agreement was the cheaper bid.
I didn't know if they gave us a bulk discount, is what I'm trying to say. You know, kind of like you go through the drive-through and
Dell
it's
put
better,
us
you get
in-
your free Coke, you know?
Yes.
you
Due to
bundle
our
the product-
size, a lot of these are based on your product spend with Microsoft, so there's not much of a discount they can do. I do know Dell put us in Group D for their discounts. I can't speak to why the other vendors are higher. But Dell did provide a larger discount and the cheapest price for these two license programs.
And these two contracts, RFP is checked.
Yes.
So,
Again, there was not a formal MS request for proposal, but we did get all three quotes.
okay, what's the threshold for doing a formal RFP?
That I do not know.
Dr. Blackledge?
Yeah, I do not believe that we have established a formal threshold. That's something that we will look into, though, and we will align ourselves with Metro to have that conversation. But at this point, I do not believe that we have a formal threshold.
And Derek's not here yet, I don't think, so that is something we can take up with our Metro appointed attorney and make sure we circle back on that. Okay. So, sorry. No, that's gonna. Any further discussion on the Dell CSP contract? Seeing none, I'll entertain a motion to approve the Dell CSP contract.
So move.
Second. No further discussion, all in favor? Aye, motion passes. Dell MPSA contract.
The MPSA contract is for all of our on-premises license, things like our desktop computers, our virtual desktop infrastructure, servers, databases, things of that nature. Those are done under a 3-year contract. And again, that was part of the software assessment that then those numbers were then bid out to Software One, Presidio, and Dell came back as the cheapest price. One thing to note is that while the MPSA is more expensive than last year, that's because the Windows 11 licenses moved from that CSP agreement down to the MPSA agreement. But combined, it's still a $38,000 reduction in price. In the future, We did have to buy additional SQL licenses. Once those SQL licenses are paid for within 3 years, this contract will go down another $62,000 because at that point you're just paying software assurance. We're not purchasing those licenses anymore. You're just paying for the right to use them and upgrade them.
It seems like I should have a relevant question here, but this is so over my head at times.
It's
so
all just licensing.
It's all just licensing. So you have to pay an upfront fee of
So
this.
you have to purchase the product, in this
Right.
case SQL.
Right.
It then comes with software assurance, which if you think of it more like insurance,
Right.
once the product is paid for, all you pay for is that software assurance, which will then give you upgrade rights and the permissions to continue using the software at about, it's between a third and a half the price of purchasing those licenses. So it's a greatly reduced price to continue using those into the future.
That's once you pay it off. Is that
Once
accurate?
you've paid for the purchase of the product, yes.
So hypothetically, if you paid it off in the first year,
Yes.
you wouldn't have. This is basically PMI insurance in a software packaging, right? It goes nowhere, and you're paying for it because you've not paid the product off, right?
Well, so the purchase plus software assurance is $18,000 per license.
Okay.
And then in the future, you will only be paying the software assurance, which is $7,700 approximately.
Okay, so let me also ask a follow-up question to this: is if and when we need to upgrade our actual physical products, our desktop and our servers, then we go back to square one, correct?
No, these licenses, they belong to us, and we can put them on any equipment we want in the future.
Okay, so this is truly
It's the software license where the hardware is not a part of this.
okay. The only time we would do that again is if we change software.
Correct. If we went from, say, SQL to Oracle, or if we switched from Microsoft to, I don't even know what other vendor there would be. Apple, for example, then we would have to buy Apple licenses instead of Microsoft or Windows. But as long as we continue to use Microsoft, which most companies do, this licensing will stand regardless of the hardware that we own.
Okay. All right, any further discussion? All right, seeing no further questions, I will entertain a motion to approve the Dell MPSA contract.
So moved.
I'll second. If there's no further discussion, all in favor? Aye, motion passes. I would be interested longer term, not for purposes of today's discussion, but to get an idea, and I don't know that this is an option, and again, I just bring things from other sectors to the table here since I'm not an IT. I struggle with even sometimes getting my monitors to align. Is there a way to look at the cost we pay, let's say Dell, in all these different areas, kind of like banking, right? Let's say you have a mortgage, you have a money market, you have a checking account, and then you have your investments, right? And then you want a commercial loan. Are you doing that at SunTrust Wells, Bank of America, et cetera, or is an opportunity to do relationship pricing? And forgive the terminology, but is there a way to look at what we're doing comprehensively with Dell or with Microsoft? Say, hey, by the way, we're giving you all this business. I understand you won the contract here, but here's what we're doing as a whole. Is that even an option in technology? You don't have to
It is.
go through
We do
that, but I think
similar
we
things
might.
with Presidio. That's why so much of and Presidio, while they provide some services, primarily we use them to purchase our hardware, purchase like our network, our server infrastructure all came from Presidio, even though it may be Cisco or Dell products, because they were actually better priced than Dell itself.
All right, thanks for the insight on that. Next contract is Microsoft.
This is the Microsoft support agreement. It's a 3-year agreement. This is for support of everything Microsoft. Microsoft has thousands of products. This includes Office, such as Word, Excel, PowerPoint, also email and all of its related servers, security products, mobile device management, infrastructure services. It's everything Microsoft. And while we do have senior system administrators on staff, we have 2. I myself am Microsoft certified. I'm also Cisco certified, but I mean, there's going to be times when you run into a wall and need support.
Question I have on this contract is not the support, but do you see any opportunity at some point where we would not have this level of support that's needed? Meaning through training, is that something that we could support you or another teammate to get a higher level of certification where we could reduce this cost and invest in our people?
I think it would be several employees we would need to hire because given the breadth of Microsoft products, to have one person or even two that are an expert in everything, where when you call Microsoft support, they may have an entire office team so that if one doesn't know, there could be 100 people on the other side of that phone number.
That makes sense. Okay. Any other questions, discussion points? Seeing none, I'll entertain a motion to approve the Microsoft contract.
So moved.
Second, no further discussion, all in favor? Aye, motion passes. AT&T.
All right, this goes back to the data circuits. AT&T will be providing the interconnectivity between all of our sites. We have Nashville General, the data center, Bordeaux, Metro Center, and ARKids. All of those sites need to be connected in order for communications to happen. Again, these were bid out to AT&T, Lumen, and Comcast, and AT&T was chosen for price and carrier diversity.
Any further discussion? Sorry, I was having trouble finding it in my book. All right. Seeing no questions, entertain a motion to approve the AT&T contract.
So moved.
Second. No further discussion. All in favor? Aye, motion passes. Next is the Lumen contract.
Lumen provides internet at Nashville General Hospital. So while Comcast will provide internet at the clinics, again, for carrier diversity, if there was an issue at Comcast, you don't want all of our sites to go offline. Lumen currently provides internet here at the hospital. And so that's a renewal from their side.
Any questions? Okay. Seeing no questions, I'll entertain a motion to approve the Lumen contract.
So moved.
Second. No further discussion. All in favor?
Aye.
Aye. Motion passes. Thank you so much. Appreciate your time and the explanations. All right. Next up is the fiscal year 26 budget. Dr. Blackhurst.
Madam Chair, may I
Yes, sir.
ask a general question about contracts? I think perhaps last month or the month before, we asked to be made aware on contracts of whether these were in the budget or whether there's something that are outside of the budget. I don't know if you can make a general statement about that or not, but I didn't see that information on any of these.
Right, and we can provide information that clearly states that moving forward, but I can attest that I've had a conversation around each and every one of these items that were presented this evening. So the renewals that were presented, I was well aware. We've looked at that within our budget, and we're going to speak to the budget coming up next. But absolutely, and we will provide a written summary or document that says whether or not we acknowledge that within the budget. Thank you. All right, and I'm just going to do a quick time check. It's 3:40, and I know we've got a couple of items on the agenda, so I will run through this pretty quick. Dr. Nettles has read the mission statement, which is really the reason of why we exist. Really quickly, I want to share, and I will respectfully at the end ask for the board to approve the budget because that's part of our requirements. But we presented a budget to Metro probably in February, then again in somewhere in April. But I do want to point out what's to the left is what we initially presented with the light blue, and you should have a copy in your packet. And to the right with the green header as what was returned to us with some modification. The modification I will point out is only around the subsidy. The subsidy we requested was $66 million. The budget returned was less $6 million, which left $60 million in the subsidy. So based upon that return, we've made some changes. Those changes, our attempt is to point out those changes as key variances listed to the right. So basically what we did was increased our patient revenue by 2%. That was about $5 million. That resulted in a $1.1 million change to our net patient revenue. We've talked about the city supplement, just moving top to bottom. We've talked about the city supplement. Salaries and benefits, if I cover that, 1.4 increase. We reduced some of our expense areas. Those include contract labor, supplies, pharmacy, and many in the room already know that we've been focused on cost containment strategies and reduction strategies since early March. At the end of the day, what this means is where we anticipated operating margin about 2.4, we're operating margin about $300,000. So I do want to share that these are the key changes or key variances as it relates to that piece, and changes within our supplies, contract labor, pharmacy items, and then our revenue. We can go to the next page really quick. I won't get into the details, and maybe, Chair, I'll bring this back next month to really talk about our plan, but you've got 4 window panes that deal with how we intend to achieve our budget targets, and I'm happy to cover those 4 panes at a different date and time. I think it's more important for us to get to some of the other items on our agenda today. 3 of those things I'll share is making sure that we have a tightened workforce management, having sustained process improvement, and stabilizing our revenue stream. The next slide is really about how we fuel our mission. If we go clockwise, it's patient revenues, it's other revenue, we have pharmacy, other components to our business, state funding, DISH money, and then the Metro subsidy. At this point in time, I'll entertain questions, but I do respectfully ask the board's approval for the budget presented. And for awareness, the budget information has been shared with the council, with the mayor's office, and other stakeholders involved.
Mm-hmm. Seems pretty good.
Thank you for the work on the budget. I know that you guys have been working a lot with Director of Finance. Appreciate the detail on the variances and all the work that you guys have been doing with Metro's Department of Finance. So seeing no other discussion points at this point, our committee will entertain a motion to approve this and push it to our full board. I'll second. Any further discussion? All in favor? Aye. Motion passes.
Thank you. That's exciting. Get that off the checklist. I have the pleasure of actually bringing up our KPMG advisory team, and as they are walking forward, I would like for them to introduce themselves once they reach the podium. But if you guys recall, in February, I was appointed to the CFO role, spent about 30 days in the assessment and working, observing, understanding, reviewing, backtracking, and then later had a conversation with several key stakeholders, including Metro, including board chairs, just to talk about the current state, and that literally led to bringing KPMG in. So I'll pass it off to KPMG.
Yeah. Good afternoon, everyone. My name's Hillary Simic. I'm a partner with KPMG. My role and responsibility around this is to lead and oversee the work stream on the accounting and financial reporting process improvements. And Chris, do you want to introduce yourself?
Sure. Hello, everyone. My name is Chris Dixon. I'm a director in our practice. I work closely with Hillary, and I as well am overseeing the process improvements and some of the financial statement impacts that we'll discuss today. It's nice to be with you.
Great. don't know if we have the slides. Yeah, so if we want to go to the next slide, it's just a quick overview of where we are today. I'm sure you guys are very familiar with the first 3 bullet points. So really jumping to May and June is when we got engaged and really kicked off our work. We've come out and have been on site for a few weeks, really working closely with the team to understand what the current state process is, who's doing what activity, how data is flowing through the process, and how people are working and communicating with each other. And for the month of June, which we focused on the May close, we've really focused on identifying some quick wins in terms of where can we make process changes or improvement changes immediately that can really roll into the close for June and year end. So what we're going to show today or walk through today are really some of those quick wins that we've identified, but also where some of the longer term changes that we've already started to identify and will continue to work through in June and August. So I'll turn it to Chris to walk through some of the findings we've had to date.
Hello, everyone. Maybe I'll start with the title up here. It says symptoms of an underlying problem. I know there are a few doctors in the audience, and what I would say, being at a hospital, is it would be very hard to treat a patient if you weren't transparent about the symptoms. So what we wanted to do is just draw attention to some of the symptoms that we, as doctors of the financial statement, I don't actually have a doctorate, but doctors of the financial statements are meant to do here. And what we set out to do over the past month is really understand these symptoms. So I wanted to highlight the first 4. I know folks in the audience have a copy of this full deck, and I'm happy to go into detail on the others, but I think the first 4 are pretty indicative of some of the things we're seeing. For instance, the first one is accrued expenses that are inaccurately captured. When you think about getting to the end of your month and making sure that you have a totality of the expenses, you need to make certain estimates and judgments. What we're seeing is that the accounting and finance function here has both different methods for doing accruals as well as different people booking and overseeing the accruals. Some of this results in changes and shifts between periods, which makes it difficult to have predictive financials going forward and, to be frank, inconsistent expenses period over period. Another example is the second. It is the inaccurate process of recording invoices. So the hospital has a variety of vendors and invoices that they're receiving each month, and there are different people and different intakes in which these invoices come to the finance function. This results in situations where there are duplicates and or amounts that remain unpaid for a long period of time. And that can cause, again, spikes in what we're seeing in the financial statements month over month and make it both hard to have predictive value in those financials as well as difficult for the hospital to forecast and budget. 2 others I'll quickly draw some attention to are the patient revenue and accounts receivable. Well, there's certainly a outsourced revenue cycle management that the company uses with companies that are trusted in the community like Parallon. Some of the things we're seeing is that the hospital itself and the finance function hasn't implemented some of the processes and reconciliations we typically see to ensure that the data being reported from Parallon to the hospital is accurate and being captured correctly. So that can lead to situations where on both a monthly and annual basis, there are differences between what's recorded in revenue on the financial statements and what's recorded by virtue of what the revenue cycle management company would report. And the last, before I pause and certainly take any questions on this slide, is the allowance for doubtful accounts. This has been an item the auditors have brought up in the past, but an allowance for doubtful accounts very simply is an estimate that companies are supposed to make on what they might not collect from their receivables. The estimate here is being done in a few different manners, and it's not using some predictive or historic data to make those judgments. As a result, oftentimes what we're seeing and what the auditors have observed in prior years is that the the hospital is underestimating the amount of revenue because they're writing more bad debt off than is perhaps reasonable in a given period. So all of these in totality are symptoms, and what we're here to do is help with those symptoms, but I wanted to raise awareness of those and set the stage before I go to the next slide. I'll pause here. I know there's much more data up there, but anything, Dr. Blackledge, that you'd like to add or any questions at this point? Oh.
I know there have been several questions about the lease equipment, so I think that is important to hear from.
Yeah, the next one down, leased equipment and how it's both captured and recorded. One symptom we noticed is a situation where there was a lease of certain sanitization equipment for medical equipment, and the sanitization equipment was received and the lease contract was entered into, but for 18 months it went unrecorded on the books. There are a variety of reasons this happened, but that long gap, as you can imagine, causes issues in tracking your financials and measuring your net assets accurately. So that's one example, but there are a few others as well. How are we doing on time? Do we want to move to the next slide or go through any further examples? Okay, perfect. Let's move to the next slide. So what is KPMG doing? We've made some observations, we've discussed the symptoms, now where do we go from there? Where we go from here is we need to track and measure success. If we don't do that, it's going to be hard when we talk to you again in a few months to talk about what we've actually changed. So while this may be hard to see, what we're trying to show here is we went through various functional areas on the company's financials, from accounts payable and accrued expenses like I discussed, to revenue, leases, property, plant, and equipment, and fixed assets, really all the way down the company's financials. And what we're doing is working with Dr. Blackledge closely to track all the areas that I observe symptoms on, potential solutions and processes we can put into place. You'll see at the bottom of this slide, we have a few items of color there. One is low, medium, and high, indicating the potential impact of change. So for instance, when you look at accounts payable, you'll notice that there are 25 or 26 items that we've noted there could be improvements. And some of those items could provide either low impact, meaning they may make month-to-month adjustments for the company or the hospital, or they could be high impact. Like, for instance, if you are not accurately recording your expenses in a given year, when you set out to budget for the next year, it becomes more difficult. So giving more predictive and useful decision information to the hospital are some of those higher impact. And we're trying to measure those qualitatively as well as quantitatively, and we'll provide more detail on that as we go through this process. But the other thing I really want to pull to your attention on this slide is the quick wins. There have been a few really low-hanging fruit in our time working with other hospitals that we've been able to come here and say, look, these are items that we can, within 30 days, get off the ground and running. And I'll give one specific example. Many hospitals, when they come to month end, will perform proactive outreach to their major vendors to get a statement of account so that they can properly accrue for those expenses. That was inconsistently applied here. Some folks were doing it with a few subset of vendors, others not as regularly. So what we've done over the past week has been working closely with accounting and finance to put a process to outreach to the main 62 vendors, which comprise almost 85% of expenses there, so that we can get a much better measurement month over month. And that's something that, while quick to implement, I think is going to have high impact going forward. The other main takeaway from this slide is you'll notice that there are a variety of line items there at the bottom. There are about 80 total observations that we're tracking to, and we're going to measure month over month how those change and develop. And we're going to use month-end close and year-end close, which happens each month, to measure success. As these get placed into the actual day-to-day processes of the hospital, make sure that the finance function is actually operating more efficiently, and we can measure some of the outputs in terms of both how quickly the close occurs, but also as well as how accurate it is and if there's any adjustments posted thereafter. I'll pause there again. I think we're coming up on time, but any questions on this slide before we close out?
I just have a comment that this is quite impressive and really taking a very proactive approach to really, again, using the medical model, identifying the symptoms and addressing it. No, but really, this is good, tangible, and you can measure it. Mm-hmm.
I appreciate that. Okay, well, I'll turn it over to you, Hillary, to take us home.
Yeah, so just last slide, and where do we go from here? Chris alluded to it in some of his comments on the quick wins and implementation. So we've already started implementing those quick wins. Come July, the team will be going through June close. We'll be able to go back and see how many of those quick wins were implemented, or what else, where do we need to focus for next month to re-implement or retrain or rediscuss how those are implemented. In August, we'll continue to do the same thing, leaving the team with an implementation roadmap that might have some of the longer term recommendations that take longer than 30, 60, 90 days, but could take a couple of quarters or 6 months to implement, so that they know kind of what the recommendation is, how to implement it, and what the benefits are. Along with that comes year end. So we know the financial statements and the audit is very important, and that'll be a big part of our focus as well for July and August. Any additional questions? All right. We appreciate your time. Thank you.
Thank you. Thanks so much for the report. I appreciate it and look forward to the next iteration of this. I appreciate the detail and operationally where we're going to end up. So thanks. Dr. Blackledge, financial statements and revenue cycle.
Right. I do want to take a moment and pause and introduce Ray Mercado. He's on this side of me to the left, so if you guys can see Ray. But Ray joins us with 20 plus years of experience in finance and finance operations. His background in behavioral health, hospitals, family business. He also is a graduate of Ole Miss, and so he's intending to stay within the SEC. So I give a big roll tide to that one. But I know we're short on time. I want to make sure that I pass the mic to Ray to introduce himself to you guys, and we welcome him to the Nashville General Hospital organization. So, thank you.
Awesome. Thank you, Dr. Blackledge. Yeah, I'm really glad to be here. I am very excited about this challenge. I think it's a very important organization, and it deserves to be well represented in terms of its financial health and condition, and in reporting. Serving the underserved is such a blessing to be a part of. And I will say, again, quickly, I know we're up on time here, but the most important things, that the way I look at it right now, is three major areas, which is first is to be in alignment. Dr. Blackledge and I are in alignment in terms of what we see, what we know needs to be done, and how to move forward in general in terms of how to solve some of the issues that we see in front of us. So that's important. It's also important to make sure the rest of the organization is in alignment, because once you have that alignment, you can pretty much do what needs to be done. And specifically with the finance team, making sure that we are in alignment there is so important. That's how we change the culture. That's how we make the changes that need to be made. And the second is, I can't really overstate the significance of KPMG's involvement. It is such a blessing to have them here and to help provide kind of the mechanisms, the way forward in terms of policies, procedures, just taking their expertise along with us and making the changes that we need to make. It's huge, and it gives us, some additional credibility and helps us move forward with confidence. And then finally, I guess the way I look at being here is, I'm sure people have read the book Good to Great, but getting the right people on the bus, right? That's one of the things we're looking at, making sure they're in the right seats on the bus, and And one thing that really sticks out about that whole thought process is discipline. We need disciplined people. We need to be disciplined in our thoughts and in our actions so that we can make the needed changes to, do what a finance department is supposed to do, which is, provide timely and accurate financials, work across departments, and communicate, infuse the finance function throughout the organization. So glad to be here. Thank you.
We're glad you're here too, so welcome. We're not too hard on you, hopefully, especially the first time. Second time, gloves are off, so welcome. And we're not joking, just ask anybody in the room. We're smiling, though, we're smiling. In lieu of time, I'd like to go ahead and adjourn our Finance Committee meeting. I know we're going to hit this again in the full board meeting, so make sure we stay on time for that if that works for everybody on the committee. Okay. All right. So that being said, I will ask for a motion to adjourn. Second. Thank you.